What's going on, everyone? Welcome to the Thursday edition of the Pandemic Update for Thursday, May 25th, 2023. Hopefully everyone is staying safe. Hopefully everyone is staying healthy. And if you had to take a COVID test, hopefully it is negative. I know cases are starting to rise in many places. Right now, you're going to see a lot of data that really supports that today. Starting off here. India records another 535 new COVID cases in 24 hours and 5 deaths. Let's get through some headlines here. A lot of things, I'm just going to read headlines because we do have a ton of news stories to get through to today. COVID-19 outbreak hits a nursing home. This is in Hawaii. Hilo Nursing Home includes 93 cases and 1 death. Luckily, it's only 1 death so far, but as you know, that's one too many. And 93 cases, so hopefully that doesn't translate to more deaths. And we do have this, a mysterious illness is going on in big cats in Florida. It's known as leukomyelopathy. A mysterious illness is leaving Florida panthers and bobcats vulnerable to predators and car strikes. A neurological condition causes big cats to have difficulty walking. Moving on to this, scientists propose long COVID definition or study definition based on key symptoms in a large study. So this is some good news that we're seeing more studies conducted about long COVID. Moving on to this up in Canada. Saskatoon COVID-19 wastewater data shows infections doubled in the city. This is up in Canada. And their wastewater has gone up by 100%. And it says information released by the Global Institute for Water Security says the data covers the period up to May 14th. So it doesn't include this week, but the point is their wastewater has gone up by 100%. Speaking of wastewater, this is the wastewater signal in North Toronto. And yes, look at this. The wastewater, it's literally going straight up. You know that whoops and clangs sound on The Price is Right when you win the $25,000 or the big money prize, whatever the big prize is, you know, yeah, that's literally what's going on there. I hate to use that reference, but there's really no other way to say it. It is going straight up. And taking a look here at hospital-acquired COVID-19 in England up to May 25th, take a look at the chart. That is starting to go up as well. So a lot of signals here that COVID is rising. And now let's switch gears a little bit here. Let's talk about monkeypox. Chicago health officials sound alarm as mpox cases increase. Yeah, we have to call it mpox, but I'll still say monkeypox. And unfortunately, remember it was, I believe, 5 cases before? Yeah, that has gone up now. Officials with the Chicago Department of Health have documented 29 cases of the virus that can cause intensively pain lesions between April 22nd and the Tuesday after just recording 5 cases between January 1st and April 15th. So this is not a small rise. This, my friends, is a big rise. And I think we're probably having problems with testing in other places. No doubt in my mind are people being denied a monkeypox test right now. Or, let's switch gears. You haven't heard too much about monkeypox in a while. People may think they have something else and not even realize, ooh, I might have monkeypox. It's going to take a few weeks. As more cases continue to pop up, there'll be more news stories and more people will be made aware that, hey, monkeypox is out there again. I've said I have expected cases to go up, and just a few days ago we saw the CDC saying, you know what, there could be a resurgence of monkeypox this summer, and I am without a doubt thinking we are missing cases in places right now around the country, especially in rural areas, maybe some cities. Heck, there could be cases here in my city of Philadelphia. I don't know, because I don't even know if we're testing for it right now. Alright, moving on to this, we're just going to potentially read a headline here. COVID-19, flu, and respiratory viruses wreaking havoc across Hunter. So cases are, this is according to Hunter, New England Health Public physician Dr. David Durkheim, we are being hit by a horrible triad of viruses at the moment. Where have we heard this before? It just continues, folks. Alright, some deaths now, unfortunately. Earth, Wind and Fire star dies at age 63. The guitarist, co-vocalist, also had a tenure with the Commodores, and this was Sheldon Reynolds. He has died at the age of 63. No cause of death has been given at this time. I'll be adding this to my website archives tonight. Hopefully at some point we will get a cause of death. We also have this. Legendary singer Tina Turner dies at 83 years old. You know, the queen of rock and roll. She's had so many hits. What's Love Got to Do with It? She also had a thing with Ike Turner. They were married at one time. Very sad. Here she is. Tina Turner has died at 83 years old. And we don't have her actual official cause of death here. We know she's been sick for several years. I don't know if she's actually ever had a COVID case, but we know that she's had a lot of problems. I thought I heard that she had a stroke at one point that some time ago, back in 2021. And we have this as well. Gerald Castillo, who played on Saved by the Bell, and General Hospital actor, has died at 90 years old. Continuing, we do have yet another death. A Doyle Brunson, 10 times World Series of Poker champion, has died at 89 years old. So if you ever watched World Series of Poker, you know he was a really good poker player. Well, unfortunately, he has died at 89 years old. We did a HubUp data update today from the data on their website showing the COVID levels. Here's Massachusetts. And the forecast for Massachusetts, obviously, as you can see, is bad. So check that out down below. It's the previous video. Just before this, we did get Walgreens this week. Walgreens positivity is at 24.1%. On this day in COVID history, CDC releases data in MMWR showing that COVID-19 survivors are twice as likely to develop a pulmonary embolism or respiratory condition, and that approximately 1 in 5 adults now have at least one health condition that may be attributed to a previous COVID-19 infection. That was on May 25th of 2022. Taking a look here at the latest wastewater data, and there are 144 new wastewater sites. 0 to 19% COVID being found in the wastewater is at 539 sites. 20 to 39% is at 424. 40 to 59% is at 128. 60 to 79% is at 22. And just one site is at the highest level of 80 to 100%. Taking a look at the latest variants, we will get an update on this tomorrow, but the ones that we need to watch are XBB.1.5 is still dominant at 64%. XBB.1.16 at 14.3% is our concern. And XBB.2.3 at 3.5% is a big concern as well. New Jersey. This is somewhere that we're going to be watching very closely for the next couple of weeks. They have already started to rise. They're down ever so slightly from yesterday with 212 hospitalizations, 7 people on a ventilator, 22 people are in the ICU. And speaking of New Jersey, I want to show you something today. This is the Philadelphia metropolitan area. It's Memorial Day weekend coming up. It's a big holiday weekend. A lot of people are making their way into New Jersey to head down here to the New Jersey shore. I mean, look at this traffic. Here's Interstate 95. Southbound delay just continues and continues. It meets up with this Interstate 76 delay, and look at this. There is just miles and miles of stop and go traffic on Interstate 76. This is the Waltman Bridge. That's the big bridge that takes everyone there. Some are opting for the Ben Franklin. And look at this. Yeah, New Jersey, without a doubt, is going to see an explosion of COVID cases. Unfortunately, we don't have wastewater at the shore sites south of Monmouth County. Why, I don't know. It's really stupid. And guess what? Some people are going to the Delaware beaches, too. Doesn't stop there. I mean, look here. Here's New England traffic. Yeah, and this will be way worse tomorrow. We'll have another look at this again tomorrow. Pennsylvania. We do have some concerns here. Pennsylvania is rising. Philadelphia COVID hospitalizations are rising. 35 people in the hospital this week versus, what was it, at about 25 or 26 last week. So that has gone up. And let's take a look at a statewide level. And on a statewide level, I actually have a sticky note here. Pennsylvania has 260 people in the hospital. Now, that is up from last week. And we always like to show Centre County. Fortunately, the Centre County dashboard has stopped working. Maybe it'll come back someday. I don't know. But they're up to 8 people hospitalized. But here's something you should be concerned about. If you live in that county, take a look at the surgical bed situation. Yeah, 0 Zero. Zero surgical beds. They do have 7 ICUs. They do have 6 pediatric beds, but medical surgical beds, they're currently out of them. Taking a look at one last thing in Pennsylvania, Philadelphia EMS call total for Wednesday was 734. Let's take a look at New York State. New York State cases and the positivity continue to rise. Mind you, these are just 539 new cases, not including reinfections or at-home tests. Positivity is now up to 4%. 7-day average is 3.1%. I would say this positivity is rising at a decent rate now, relatively quickly. It's just not long ago that was only 2.5%, and we are probably going to watch that continue to rise. Taking a look at hospital admissions in New York State, you can see here they're holding steady to maybe about to slightly rise. And if we take a look at hospitalizations, they're down ever so slightly from yesterday, but the overall trend is bouncing off the bottom to maybe starting the upward incline. And when we take a look at New York City, similar thing can be said. Bouncing off the bottom, but maybe a slight upward incline is going to start pretty soon. All right, Texas. This is super concerning. Current week for Texas, this is cases. They added 10,664 new cases. That's double from last week, but there is a reasoning for that. For everything, there's a reason. And the reason for this is they did add some older data. I don't know how many of these cases are actually from the older data. So it's safe to assume Texas is starting to rise. They had 35 fatalities this week, and the hospitalizations did rise by 18 to 726. So that's concerning as well, that their hospitalizations are starting to rise. Let's take a look at some international COVID cases. And we can see here, South Korea cases are down 5%. Deaths are up 35%. Brazil is down 44%. The deaths are up 30%. Russia cases up 24%. Deaths up 37%. Greece cases are down 29%. Deaths are down 13%. Philippines cases down 2%. Deaths up 1%. New Zealand cases are up 19%. And deaths are up 19% as well. Vietnam cases down 30%. And deaths are up 33%. Mexico just down about 0.5% for cases and down 2% on deaths. We come down here to Hong Kong. 17% increase in cases, 35% increase in deaths. Thailand still has a 12% increase in cases, and deaths are up 191%. Then we come down here to Afghanistan. Cases are down 20%, and deaths are down 90%. Belgium, cases up 222%, and deaths are up 200%. Alrighty, that does it for our international update. Some news and notes to report on regarding the channel. Tomorrow we will hopefully have the variant proportion update. It's supposed to update every other Friday. We're due for that tomorrow. I don't know if we're going to get it because it's a holiday weekend coming up. And this weekend, we're probably not going to see much on the data front. We'll probably have some news front. The pandemic update's staying all weekend. We'll have our usual weekend stuff. Wastewater update will be on Sunday. Hopefully we get some more wastewater sites to update. Sometimes they do on Fridays. So we'll just have to wait and see about that. We may or may not have the editorial piece on Saturday, where I give my weekly opinion. Haven't decided what the topic's going to be or if I'm actually going to do that. Some site news. Let's go over to my website here, shall we? Here's my lovely website. I'm going to be doing some work on the site this weekend. I'm going to be adding to the COVID positive archives a lot of past cases. I don't know how many I'll add. I also might reorganize it. I might do it alphabetically, where I split it up into different alphabets, or I might do it by celebrity, political leaders. Haven't decided yet, but that archive is going to continue to grow as I do past cases, and plus any future cases. It's at 177 topics, which obviously there's some topics include multiple cases of celebrities, so that's growing, and it gets to a lot of pages. It gets hard to find, and I know maybe people might be interested in searching if someone has had COVID or not, so we're going to make that easier to see. And I think I may also break up the COVID studies, whether it be to different topics like heart condition, stuff relating to the brain. So I'm going to be working over that to make it easier to read over the next several days. Alright, if you're going away this holiday weekend, please be safe. We'll have another message probably again about that tomorrow. And that's it for today. stay safe over the next 24 hours. Test negative. Avoid large gatherings. Cases are going up. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. I'll see you all again next time. Thanks for watching, everyone.